Trauma is like internal trash. Several years ago, my younger brother died by suicide. This was a traumatic event to me. And to make things worse, during the funeral, one of the most unbelievable things happened to me. I was in line greeting my brother's friends who came to pay their last respects when I unexpectedly was blindsided in the worst way. I suddenly found myself shaking the hand of the man who had sexually abused me 38 years earlier when I was 11 years old. Now, I will explain how I overcame this personal trauma. Post traumatic growth is possible after all trials and traumas in life. Warning, this is not therapy, but educational tips. When you decide to address past trauma and take steps for positive change, you may experience some temporary stress and possible flashbacks as you walk through that trauma with a professional. If we're just meeting for the first time, I'm Hugh Watt, author and founder of Trial Tappers. And who are Trial Tappers? People that find hope, resilience, and post-traumatic growth after life's trials and traumas. Our motto is we tap the pain, we find a path, and we grow stronger. How do you deal with the extreme trials and traumas in life? Someone once told me that not dealing with trauma is similar to not taking out the garbage. I've taken that example to heart. And as I help clients relate to this image, I often show this image that I had drawn. The visual lesson is tap your trauma trash can. The image is of an old metal trash can that is full of so much trash that it's overflowing and falling onto the ground. Some of the debris includes an empty beer bottle, a milk carton, scraps of food. The debris is labeled anger, depression, and addictions. Above the trash can is a large military type boot that is moving towards the top of the trash can. The boot is labeled silence. The trash can is labeled in the words trauma, loss, and abuse. Think of your own home and the trash that needs to be taken out. In my home, we attempt to push down that trash further and further until it can't be pushed down any farther, right? Until we're forced to take that out. The practice of repeatedly pushing down trash eventually leads to leaking, smells, and often spilled garbage on the floor. When I come across homes that refuse to take out the trash, it smells, and sometimes it's overwhelming. Some people actually take the trash bags out of the can and leave it a full bag next to the trash can. Not only is the trash overflowing the cans, but they're saving it. Imagine if we all had a symbolic trash can inside of our bodies. This can fill up our emotions and feelings when we experience trauma. Research shows that many of us have or will experience some form of trauma in our lifetime. Refusing to admit that we have these feelings and emotions after a difficult trauma will lead to this emotional garbage leaking out, smelling, and dumping out unexpectedly. Often the symptoms or reactions I see with clients in their bits of garbage overflowing their emotional trash can be obvious. The leaking and the smelling might be anger, depression, addiction, other things. When a client only wants to address these outside symptoms and refuse to empty the emotional garbage that's inside, they will predictably slow down their growth and struggle with the similar trials in the future. When I take my actual garbage out of the home, I take it to the street and give it to a professional who knows how to sort through that and recycle it and turn it into other products that can be useful. I chose to empty my emotional garbage in relation to the suicide of my brother and the sexual abuse as a child. Family and friends were sympathetic to my pain, but it wasn't until I reached out to another professional that I was able to fully empty my emotional trash can. I can tell you this truth from decades of experience. Getting past the observable symptoms to the underlying root of the problem is always the hardest part of the therapy. Often people come to treatment with an internal symptom or a surface problem or a safe problem. The examples might be obvious. Sometimes I'll talk about addiction or marital problems or depression or anxiety or anger. Now, grief and sorrow after a trial will not impact you at the same level as it will an internal trauma. The effects or reactions of trauma on a person can be suppressed for years without anyone able to identify the original source. Many who have experienced traumatic events show very little emotion during the actual experience. For example, victims of rape are often known to freeze up and not exhibit any outward reactions about what's happening. They're in shock. When someone experiences this type of extreme trauma, their outward appearance may be stoic, but their internal emotions are extreme. If you're finding any value in this video, please like and subscribe. When I came face to face with my childhood abuser at my brother's funeral, I re-experienced the trauma and I froze momentarily. There I was asking myself questions like, what's happening? Am I dreaming? Why can't I speak? Why can't I breathe? I was just confused. I was in shock and I couldn't move. The flood of memories and fear from my childhood made me freeze up. Another brother standing next to me noticed something was wrong and he stepped between me and my perpetrator. Then I was able to walk out of the church. I struggled in silence with the secret for many years. And at the age of 21, I decided to discuss these things with a religious leader. And about age 25, I informed my wife about the problem, but I never really focused in on the actual trauma. Everyone was helpful during that time. They reassured me I'd done nothing wrong, and that was fine. The big problem was that I never really addressed the deep trauma. And I recognize now that I might not have been ready to do that at the time. I only worked on the symptoms, right? I wasn't ready to open up the wound of the abuse. Now, when I look back, I realize I never really explored the feelings or the reactions that were associated with that abuse. I might have talked about the events with people, yet I failed to admit the fears and embarrassment that I had inside of me. I wanted it to all just, go away, so I would never have to deal with that again. Now, when I decided as an adult eventually to go to therapy, it became clear to me that I needed to tell my story to you now. I could have continued to hide the abuse from my family and friends, my clients, and the whole world. And I found that shame and fear that are the tools of the abuser that he used to help keep me quiet as a child in most of my adult life. I realized what I needed to do and what I needed to learn is that I needed to share my personal story experiences with others. Failing to address these types of internal emotions will not prevent your body from feeling them. It will slowly react over years, and your brain continually reminds you and your body of this past. Your internal systems will start reacting. For example, as you're listening to this video on trauma, in your head, you might be saying things like, I don't know if I want to continue watching this video. Also, you might be experiencing some internal anxiety. Your stomach might be aching, your foot might be lightly tapping, you might be sweating, you might be becoming anxious, you might be feeling nervous and your heart might be racing and your head, you might be aching in your head, you might be sitting perfectly still. But if I hooked up a EKG electrocardiogram up to monitor your heart, I might see that your heart rate and your blood pressure are increasing. See, addressing your trauma might be a deep subject that's difficult for you to talk about. Physical symptoms or complications may be your body's typical reaction to this unresolved trauma that's leaking the out of that garbage that it needs to be addressed and possibly worked through. If you're having these types of thoughts or reactions, you might need some help to get some professional help with a counselor. Once I can convince a client to address the past traumas, their emotional release will sometimes be explosive and anger may happen. When you experience abusing substances, anxiety, anger, depression, self harm, reoccurring memories, flashbacks that are unexpectedly triggering experiences, uh, experiences with sounds or smells that may happen, your body might be communicating to you that you need some professional assistance. If you are missing these warning signs, pay attention to helpful feedback from your family or your friends. Failing to deal with this and not empty that emotional trash can from the past traumas will prevent you from successfully helping others going through similar experiences in the future. I have witnessed people attempt to help others with a particular trauma because they experienced something similar in the past, but often these helpful people fail to realize that they never truly emptied out their own emotional trash can. Their past traumas leak out and contaminate those they're attempting to help. The challenge will always be to admit and or identify the root of your problems. The next step is to identify your core beliefs about the problem, accepting that you can't control the actions of others. And once you identify the actions you can control, you can make a plan to address the root of the problems and find alternative paths to achieve the goal of when you encounter obstacles. If anything I've talked about in this video has brought up some deep feelings or emotions, I encourage you to seek professional help. Addressing your trauma is helpful, but you may still struggle to find post-traumatic growth. I hope you apply these skills and become a trial tapper. Comment below what is one trauma you have overcome. Our motto is we tap pain, we find a path, and we grow stronger. Please share this video with others. Like and subscribe to help my channel.